guys, welcome back to the channel. I hope you are doing absolutely amazing. For all those who do not know me, my name is Dr. Shreya Joshi and I am a dental surgeon. In today's video, we will be discussing how we can read and prepare the subject of pharmacology for our BDS second year. Besides that, I will also be telling you with little extra effort how you can prepare this subject for your NEET MDS as well. NEET MDS will be subsequently replaced by the next exam, but as of now, to secure a seat in MDS, that is to pursue your masters in the field of dentistry, you have to give this exam of NEET MDS only. Okay, so I'll be telling you that how you can prepare this subject of pharmacology for second year as well as for your NEET MDS simultaneously. Okay. Now before we move on with this video, I would just tell you that it would be a bit longer one. Reason is I want to cover everything in detail, okay, so that it helps you. So my advice would be, please keep a copy and a pen along with you, and along with that, if possible, grab a cup of coffee or tea so that you can listen to me patiently and attentively till the end of this video, so that you can jot down all the important points that I'm telling you. Believe me, it would be really very helpful. So without any further ado, let's get started. Now first we have to understand why this subject of pharmacology is important. Now this subject of pharmacology is important for your second year as well as for your NEET MDS. Okay, it holds a lot of weightage in your NEET MDS exam. But besides that, besides its theoretical importance, this subject is also very important clinically. Now why clinically? Once you complete your degree, you become a doctor and you open your clinic, what happens? Or you sit in any hospital, go to any hospital, what happens when the patient visits you in your OPD? You have to prescribe a lot of medications, lot of drugs to the patient. Now if you do not have a very good knowledge of this subject, what happens is you do not know about about the indications of the drugs, about the contraindications, the side effects, drug interactions, in which conditions a particular drug can be given, it cannot be given. So what happens is when the patient turns to you and you have to write medication according to the medical history of the patient, it becomes very difficult if you do not have good knowledge of this subject. That is why studying this subject in a proper way, in a proper manner and attentively is very important. Okay. Now we are going to discuss how you can prepare this subject, and we will discuss it in the form of a comparative study. Okay. First I'll tell you how it is for second year, and then simultaneously I'll tell you how for NEET MDS. Now this video is divided into 3 segments. In the first segment, I'll be discussing about the difference in the pattern of the exam. Okay. First, how questions are asked in your BDS second year. In BDS second year, you will get subjective questions, that is your long answers or maybe short notes. Okay, I'll quickly give you an example. Like you can get a question, classify antihypertensive drugs and write or discuss in detail about the indications, contraindications, mode of action and side effects of the drug nifedipine. Okay, so this is the question, this is the format for your BDS second year. But what happens in your NEET MDS? In NEET MDS, you will get multiple choice questions, that is your MCQs. These are objective type questions. So you will be having a question and you will be having 4 options, out of which 1 is correct. Out of 240 questions that are asked in your NEET MDS exam, 14 to 15 questions, yes, 14 to 15 questions are from the subject of pharmacology. Now this shows the importance and the weightage this subject carries in your NEET MDS exam. Okay, so it is very important to prepare this subject very properly and very nicely. Now what happens is, out of those 14 or 15 questions that are asked, any aspirant who correctly attempts, I'm telling you about the number of correct responses. If you correctly attempt 10 to 11 questions out of those 14 questions, that means it's a brilliant attempt. Okay, nobody can solve 14 out of 14 or 15 out of 15 questions. It's just impossible. Not even MBBS students will be able to solve all of them. Okay. So even if you are attempting 10 or 11 correct, it's a brilliant attempt, it's a very good attempt. Okay. So the problem over here is, here you won't get marks for attempting the question. Okay. It's like either you know it or you do not know it. For the correct response, you will be getting a +4. For a negative response, for a wrong response, you will be getting -1. And if you do not attempt, you will get 0. Okay. So this is the thing. Whereas when you get a question in your BDS second year, even if you attempt it, okay, you know a little bit about it, you attempt it, you get marks. But that is not the case for your NEET MDS, right? Now moving on to the second segment of this video, where I'll be discussing how to prepare. How you are going to prepare. First, let's talk about BDS second year. In BDS second year, when you get these subjective type of questions, these long questions or short notes, okay, what happens is, suppose again I'll take the example, that same example, classify antihypertensive drugs, write in detail about nifedipine. Okay, so even if you know that nifedipine is an antihypertensive drug belonging to the class of calcium channel blockers, and you have read just about calcium channel blockers and its mode of action, and you haven't read nifedipine in detail, then also you can attempt the question. Okay, I'm talking about attempting the question. I'm not talking about a good attempt or a brilliant attempt that a topper does to get very good marks. अगर कुछ भी पढ़ के नहीं गए nifedipine के बारे में और ये टॉपिक आ गया, then also you can write. Okay, how you can write? Organize your answer under headings. Okay, first of all, classify all the antihypertensive drugs. After that, start writing about the introduction of nifedipine. Even if you know 2 lines, like you haven't studied nifedipine, you know that it's an antihypertensive drug belonging to the class of calcium channel blockers. Okay, and under calcium channel blockers, it comes under DHPs, dihydropyridines. That is all. Okay, for introduction. Now, coming to the next, that is write about the mode of action, where you will write about the role of the L-type voltage gated calcium channels. Okay, elaborate, write it in the form of a flow chart. Okay, then write about the indications, contraindications and side effects that you have studied for calcium channel blockers. So even if you haven't studied nifedipine as an individual drug, or maybe you get amlodipine in the question, okay, which is also a drug of the class of calcium channel blockers only, then also it's fine. Even if you have read calcium channel blockers, you will be able to attempt and you will be able to score some marks. You will pass, okay. But what happens is, when you are preparing for your NEET MDS, this is not the case. You can't, it's not like you have to attempt or तुम्हें marks मिल जाएंगे. Either you know it or you do not know it. Now, what questions they will ask in NEET MDS? Okay, they will ask you specific questions about nifedipine. So studying about each and every drug becomes very, very important, especially the ones that are frequently asked every year. Okay, now what questions they will ask? All these questions that I am telling you, you can see on my screen. I will paste it on my screen, or you will see it over here. You can take a screenshot of this, or you can jot down those questions. And believe me, in every NEET MDS exam, okay, or in your INI CET exam, these questions have been asked. The first most common question that they ask from nifedipine is, which drug causes gingival enlargement? Okay, which of the following drugs causes gingival enlargement? So there are 3 categories of drugs that cause gingival enlargement. One of them are antihypertensive drugs, under which the example is nifedipine. Okay, so these type of questions they will ask from nifedipine. Second question that they ask about the incidence rate of gingival enlargement caused by nifedipine. The answer is, in 20% of the patients who are taking nifedipine, you will see gingival enlargement. Okay. Now, another question that they are asking nowadays is the replacement drug for nifedipine. Now, what is replacement drug? Suppose any patient is complaining of gingival enlargement from nifedipine, then what is the drug, okay, that you can use as a replacement for nifedipine? The answer is diltiazem or verapamil. Okay. Another question that they are very commonly asking is, which calcium channel blocker is responsible for causing severe reflex tachycardia? So for all those who do not know what is severe reflex tachycardia, it is a quick fall in blood pressure. The answer for this is again nifedipine. So such type of questions are asked in NEET MDS. Okay, these questions you never cover in your BDS second year. That is the problem. Now what I am telling you over here is, with little extra effort, okay, you can have an extra edge over others. What you have to do, जो सब्जेक्टिव क्वेश्चंस आपने सेकेंड ईयर के लिए प्रिपेयर किए थे, उसी के साथ जस्ट प्रिपेयर दिस एक्स्ट्रा क्वेश्चंस इन योर नोट्स. ओके, जस्ट राइट इट इन योर नोट्स ओनली. If you prepare these extra questions, it will minimize your effort during the time of internship when you prepare for your NEET MDS. What happens is, when you are preparing for your NEET, at the time of your internship, it is very, very hectic. I know it is very hectic. You have to go to the college, you have to see the patients in the OPD, okay, then you come back and you have to make notes, then you have to learn, then you have to revise, okay. So it is not possible to manage all these things. So if you prepare your notes right from second year in such a way, it will help you a lot in your internship. At that time you will not have to prepare notes. What you can do is, whenever you have time during the college hours of your internship, or maybe in the or after coming back from the college, you can just flip over those notes. You don't have to prepare those notes. Otherwise, what happens with maximum aspirants, they start preparing notes and one full year of internship goes in preparing notes only. Okay, so it's a waste of time and waste of year. Okay, so it's better that you start preparing from second year only, and not only for pharmacology, but I would advise you for every other subject. You should do like this only. Okay, just try to find out what questions are asked in your NEET MDS. Okay, and just add on those extra points to your notes. This will provide you an extra edge over others. I know the schedule of BDS second year is very hectic. There's a lot of practical work to do in second year, and it will be really very difficult to manage all this. But believe me, if you give a little more time, okay, you will be able to do it. I'm telling you from my own personal experiences, and sometimes I feel that probably someone would have told me, it would have been, I would have secured much better rank than what I got today. It's pretty good, but still I think कि मुझे किसी ने बता दिया होता ये सब, so I would have secured a better rank. That is why I want to share all this with you guys, and I don't want you guys to make this mistake. Now coming to the third segment of this video, that is which books to follow. Okay. I'll quickly tell you which books to follow and from where you can get all these questions, okay, and how you can add on to your notes. So if you are preparing only for second year, that means purely for second year, you are not interested for preparing for your NEET, okay, NEET MDS. You are not planning to go for MDS, or at that point you don't want to prepare. Although my advice is, if you want to do MDS, just start preparing from second year, first year as well, the respective subjects, okay. But if you want to study only for second year, then the best book that you can follow, followed by all the BDS second year students, that is this book of KD Tripathi. Okay, this book you can follow. Very nice, very authentic textbook. This is what all the BDS second year students follow. Even I followed this textbook. But if you want to prepare for your NEET MDS, then I will add on one more book. Okay, that is your GRG, Govind Rai Garg and Sparsh Gupta. Very, very authentic textbook. All the references in all the MCQs for your NEET MDS you will get from this particular textbook only. Now the problem with this textbook is it is a very vast textbook. Okay, medical students also follow this textbook. There are lot of topics that are given in this particular book. You don't have to study everything. You have to screen out. Although there is no limitation कि MDS के entrance में इतना ही पूछा जाएगा, कोई subject की कोई boundaries नहीं है. They can ask you anything, but still whatever is there in the dental syllabus, there are certain drugs which are not in our syllabus that you can avoid from Govind Rai Garg. Especially in your initial subjects of initial topics of general pharmacology, where a lot of graphs are given. Only those graphs and those concepts of general pharmacology you have to study, which are asked in NEET MDS. Okay. Besides that, for KD Tripathi, you will follow the MCQ book also for KD Tripathi. Okay, there is an MCQ book available in which all the previous year questions are given. And in Govind Rai Garg also you have the previous year questions given for pharmacology. So these are the places from where you can pick up your previous year questions for NEET MDS and you can add on in your notes. And besides that, where you will get your previous year questions from Dental Pulse book. Okay, you can get it from Dental Pulse book, or you can follow Neeraj Wadhwan. Dental Pulse is what I followed. Okay, this is the older edition that I have. Okay, the older edition that I have. You can follow the new edition of Dental Pulse. Okay, and besides that, you can follow Neeraj Wadhwan. Both of them are the textbooks for previous year papers for NEET MDS. So for state entrance exam or for any MDS exam, whatever questions have been asked, okay, are given in this textbook, and from there you can find out what questions are asked and you can add on to your BDS second year notes. Now this was about how you can add on to your notes and how you can prepare in second year only. Now one more thing that I want to add on is the role of mnemonics. Role of mnemonics is very, very important when you prepare pharmacology. Okay. Now lot of mnemonics are given in Govind Rai Garg as well as Sparsh Gupta. So you can read all the mnemonics from there. They will help you to memorize all the drugs properly. The only problem with pharmacology is it's a very interesting subject, very nice subject, but the only problem is that you cannot remember things over here. Okay, you tend to forget the names of drugs, the classifications, especially if we go to the classification of cephalosporins, first, second, third, fourth, fifth generation. It is very difficult to remember. So with the help of mnemonics, you can remember all those drugs. Okay, how to make mnemonics, how to study that we'll cover in a separate video. Okay, now one more secret tip. All these questions that you will prepare, okay, in your second year from your MCQ books for NEET MDS, they are also the questions for your second year pharmacology viva. Yes, what happens जब हम viva के लिए जाते हैं second year में pharmacology के viva के लिए, then what happens is whatever question that they ask, we are not able to answer most of the questions. Reason, we haven't studied the drugs in detail. So what basically they are asking, what I have realized is they are mostly asking the questions that are asked in NEET MDS in your viva. So in a way, you are also preparing for your second year pharmacology viva. Okay, so this is an added advantage. Now that was all for today's video. I know it is a bit longer one, okay, and because I wanted to cover a lot of things in details, I have given all the questions on the screen. You can take the screenshot, you can note it down, okay, whichever way you like. In upcoming videos, I will try to arrange a whiteboard or maybe some form of board where I can teach you, I can write and show things to you and teach you. And one more thing before I end this video is you also have to have a lot of focus on image based questions. Okay, nowadays they have started asking image based questions from pharmacology. आप पूछोगे कि image based questions कैसे? Image based questions pharmacology में they are asking from graph, concentration time graph for the drug, okay, pharmacokinetics, pharmacodynamics, order of kinetics, all those graphs that are given in general pharmacology are very important. You can cover them from Sparsh Gupta and Govind Raigar. Okay, so that was all for today's video. I hope this was helpful and informative for you. Believe me, if you follow these tips, you are definitely going to have an advantage over others. So please try to follow what I told you. These are from my personal experiences. If you liked this video, please do consider hitting the like button. Share it with the maximum students and aspirants so that it can be helpful for them. And also comment down any of your questions, suggestions, thoughts below, and I would be really happy to know what you feel about the videos, or if you want to ask anything, I'll be very happy to answer them. And please do consider hitting the subscribe button, because it would really motivate me to make more such content ahead. Very soon I'll be joining my MDS seat. I'll be updating you about that in my subsequent videos. It is very difficult to make these videos amidst all this counseling that is happening. Okay, and if you would subscribe, it would really motivate me to make such content ahead. Till then, keep working hard, stay motivated, and I'll see you guys in the next one. Bye bye.